Learn everything about pharmaceutical analytical method validation in just 18 minutes. Hello, assalamu alaikum. This is Imran and welcome you all to Imran speaking. In a pharmaceutical industry, the scariest thing that we face in our job life is audit. One of the most critical part of auditors is to ensure that every process, procedure, system that are being used in a lab is validated. So, in order to face audit successfully, validation must be performed rationally and the whole process must be understood properly, without which audit may fail and a heavy fine may be charged, along with banning also, let alone personal growth and performance. Understanding analytical method validation will instantly turn you into a person with a better performance in both everyday job scenario and during facing audit. Now, in my opinion, the easiest way of learning method validation is to follow ICH guideline, which is both well organized and complained in almost every country of the world. Here, I would recommend you to write small notes using pen and paper in this session. It will help to write important notes on which you can dig deeper to get deep understanding. It only requires about 18 minutes to learn the basics. However, after grabbing the basic, it will take about another 90 minutes to master every aspect of analytical method validation with example. Every process is validated in a pharmaceutical manufacturing unit. Analytical method validation is a part of validation study that is done in QC lab, often by research and development analytical department. It is done to prove if the analytical method is consistent enough to produce a genuine result about the parameter that is being tested each time. Let's dive in the basic parameter of analytical method validation. Here you can see four major parameters of analytical method validation, which are specificity, range, accuracy, and precision. At first, I will discuss about specificity. Specificity is the ability of a method to differentiate the target molecules from all other molecules. For example, analysis during any HPLC method, target analyte peak must be sufficiently separate from any other peak, resulting from maybe impurities, diluents, or placebo. Now, you may ask why it is important. It is extremely important, as if the target peak is not separated from other peaks, then identification by HPLC is not possible at all. Suppose target analyte peak of pantoprazole elutes at 5 minutes, and at exactly same retention time, that is 5 minutes, another peak from placebo also elutes. If the sample does not contain the target analyte, that is pantoprazole, it will still show a peak in the exact retention time pantoprazole should have come, thus ending in a false positive result. This is devastating, as the patient may even will not get any drug required at all due to this false positive result. So, it is seriously important to ensure the response is coming from the analyte peak and not from any other source. Range of an analytical procedure is the interval between the lowest and the highest reportable results in which the analytical procedure has a suitable level of precision, accuracy, and response. Range can be demonstrated by the following parameters. These are concentration versus response relationship, that is calibration curve, and lower range limit, that is LOD or LOQ. Let's understand the basics. Calibration curve is the graphical representation of concentration versus response from any equipment or apparatus. It can be linear, non-linear, and multivariate. For most of the method is designed to be linear, we will discuss only about linearity in this session. Before learning linearity, one must understand calibration curve. Please click the link in the description to know about calibration curve properly, without which it is almost impossible to understand quantitative analysis completely. Here, I am assuming you already know calibration curve, so let's move forward. We all know calibration curve is created by analyzing sample in different concentrations. Then the response from the analysis is graphed in y-axis and known concentration is plotted in x-axis. If the calibration curve is not linear, then the correlation between concentration and analytical response, say it area or absorbance, will not be proportional, and so the method can no longer predict the amount or concentration of analyte by getting the response from the analysis. Let's understand with an example. Here are two calibration curves. In the calibration curve 1, the curve has been drawn by plotting multiple concentration against area. You can easily see that the calibration curve is not linear. Hence, the relation between concentration and area is not linearly proportional. Now, if we only analyze using 6 mg per ml sample and plot as graph, we will get a calibration curve like the one in the calibration curve 2. Now, this curve is misleading. According to this curve, if we get an area of 150 from analysis, it returns the value of 2 mg per ml. But when we look in the first curve, area 150 practically responds to about 1.5 mg per ml. So we must analyze different concentration and get corresponding area and then plot in the graph to see if the calibration curve is linear or not. If the calibration curve is linear, then we can determine any unknown concentration from the area obtained from the analysis. So, to validate any quantitative analytical method, linearity is one of the most crucial aspects to test. LOD means limit of detection and LOQ means limit of quantitation. LOD is the lowest concentration where any response from an analyte is considered as a response detected. Below this concentration, the response detected cannot be said to be originated from the analyte that we are expecting. On the other hand, LOQ is the lowest concentration from where we can quantize or measure the response and give a quantitative result. Most often, LOD or LOQ is required to validate in impurity analysis as the expected response from impurity are very small and tend to blend with baseline noise. Different method is available to determine LOD or LOQ, namely visual method, signal to noise ratio based on the standard deviation of a linear response curve and a slope, and based on the calibration curve. In general, it is considered that if signal to noise ratio of any peak is 3:1, we can say that the concentration is LOD, and if the signal to noise ratio is 10:1, the concentration is LOQ. I will discuss detailed about LOD and LOQ in another session. Accuracy is the most pivotal parameter of method validation and can be said as the heart of method validation. Accuracy is the ability of an analytical method to determine the true content of an analyte in any analysis. Imagine weighing yourself in a weighing scale and the scale shows weight as 72 kg. In another weighing scale, it shows 74 kg. Now, if I ask you what is your weight, you will not be able to tell the exact weight of yours. So, now consider we load standard 5 kg weight on both of these balances. The first balance shows 5.0 kg exactly, and the second balance shows 5.2 kg. That means second balance is not showing the correct value of weight. This correctness is accuracy. Both the balances may show same 72 kg and 74 kg respectively if measured multiple times, but one is showing the true result and another one erroneous. Here we can say that both the balance is precise, but first one is accurate and the second one is not. In respect of analytical method validation, measurement of accuracy is percent recovery. Here, a sample is prepared using some same placebo and API or impurities in lab. So we know the exact amount of analyte in the sample. Now, after analysis, if same amount of analyte is got by calculation, we can say that the method reflects the true amount of analyte. Let's understand with an example. Suppose we have a tablet which has 20 milligram of API and 80 milligram of excipients in it. Now, we make the sample by weighing 20 milligram of API and 80 milligram of placebo in lab and make the analytical solution as per the method. Now, after analysis, quantity of API we get from calculation is 20 milligram. Then percent recovery will be 100%. Hence, we can say that the method is accurate as the method can detect and quantify the quantity of API correctly. Precision is the third parameter which we are going to discuss today. Precision is the ability of a method to produce same result times and times if the testing condition remains same. Consider you are weighing yourself on a weighing scale. In the first measurement, your weight comes 72 kg. Immediately after that, you got down and again weigh yourself, and this time your weight is showing 74 kg. Again, you weigh immediately and get your weight as 76 kg. Again, you get 73 kg if weighed again. So in this case, certainly your actual weight is not changing, but the measurement that is being shown in the instrument is varying, and thus your actual weight cannot be concluded using this instrument. Thus, we can say that the system is not precise. On the other hand, if during multiple measurement weighing remains the same after multiple times of weighing, we can say that the system is precise. There are mainly three types of precision. One is system precision, which is to prove if same sample or standard is run multiple times using any analytical method, same response is showing or not. If same response is showing, then the system is precise. Often we perform this during system suitability check while using HPLC or GC method. In this case, only instrument is considered. Another one is method precision, which is to prove if the method, that means the sample preparation procedure and analytical procedure, both are precise or not. In this case, both instrument and method is considered. However, as system precision is already established before method precision, only method, that means sample preparation procedure, is critically validated here. This parameters is often referred as repeatability. Another precision is intermediate precision. In case of method precision, sample is prepared by one personnel, while during intermediate precision, another personnel prepares another sample, following the same analytical method. Comparison between the two personnel is performed, and if both of the personnel obtains a similar response, then intermediate precision is established, which means this method can be used by multiple analysts and still will get the same result. Note that intermediate precision is performed varying analyst, instrument, and different days, but lab will be the same. Reproducibility is another type of precision which is almost same as intermediate precision. Only difference is that it is done between two laboratories. If reproducibility is performed, then intermediate precision is not required. All sorts of precision are measured using percent relative standard deviation. Response from multiple measurement must have to be less than a certain percent RSD. We will discuss about the specifications later. Here we are going to discuss some other parameters that are being tested during method validation. First one would be robustness. So robustness is a proof of method suitability that if method parameter, any of the method parameter is changed slightly during analysis, results would be unaltered. To test this parameter, deliberate change of method parameters such as HPLC, GC, column brand, flow rate, or pH is done and the same sample is run. If result is found similar to the result obtained to the original method, then the method is declared to be robust. Generally, samples are analyzed similar to that of precision, and acceptance criteria also is kept similar to intermediate precision. Most of the method have to be stability indicating, so method should be able to isolate degradation compounds generated during stability period. To prove that a method can effectively detect degradation compounds, forced degradation is performed. Generally, 6 types of degradation factors are responsible for compound degradation, and all are considered during method validation. These 6 factors are heat, moisture or hydrolysis, acidic environment, basic environment, light exposure, and oxidation. Products are exposed justified amount of time to these environments and analyzed with the method. Method should be capable enough to isolate degradation responses to predict accurate amount of API remaining or impurities generated during stability period. Every sample solution after sample preparation undergoes degradation. The amount of time up to which the solution can be used to analyze must have to be validated. So, sample solution is prepared and kept in benchtop condition and refrigerated condition, and the response is calculated with freshly prepared solution after predefined time. The time up to which the solution shows acceptable response is declared as solution stability time. Now, let's discuss when to use which parameter for validation. As you can see the table, for identification test, only specificity is required. On the other hand, in case of any quantitative analysis such as assay or dissolution, specificity, accuracy, linearity, repeatability, and intermediate precision is required to perform. In case of impurity or any quantitative analysis where very small quantity of response from sample is to be measured, specificity, linearity, LOD, LOQ, accuracy, repeatability, intermediate precision is required to be performed. In case of limit tests, only specificity and LOD is required to be performed. In conclusion, aspects of method validation is not only limited to method validation but applicable for other validation like instrument qualification or process validation too. I believe you have already advanced quite a way to know validation. Detailed knowledge will make you apply these into practice and face audit successfully. You can see my other videos on deep diving analytical method validation. Link is in the description. It is a must if you want to get a clearer perspective on analytical method validation with a real-life example. I make videos every Friday on these sorts of interesting topics. Like and subscribe to get the updates. This is Imran signing off.